Hello and very warm welcome to everyone. My name is Simran Chaudhary from Voice of Healthcare, and it is my pleasure to welcome you all for the another insightful edition of Navigating Migraine with Experts, Not Assumptions. United for Better Migraine Care, an awareness initiative by Voice of Healthcare, supported by Amneal Healthcare. When we talk about migraine, we know that migraine is far more than just a headache. It is one of the most common yet misunderstood neurological disorder affecting nearly 200 million people worldwide, including an estimated 14 to 20% of India's population. And beyond its pain, migraine significantly impacts physical health, emotional well being, productivity, overall quality of life. But despite this, its widespread prevalence continues to remain underdiagnosed and underrated due to persistent misconception, delayed recognition of symptoms, and limited awareness of the treatment options available today. And through this series, our objective is to replace assumptions with evidence, encourage timely diagnosis, highlight advances in migraine science, and empower patients and healthcare professionals with credible, evidence based information that can ultimately lead to better outcomes. And to help us navigate this important conversation, we are privileged to be joined by an exceptional panel of distinguished neurologists from across the country. It is my pleasure to introduce our esteemed panelists for today's discussion. Dr. Professor Manmohan Mehndiratta, Emeritus Professor of the National Academy of Medical Sciences, India, Principal Director and Senior Consultant, Department of Neurology, Center of Neurosciences at BLK Max Super Speciality Hospital, New Delhi. Thank you so much for joining, sir. It is a pleasure to have you.
Thank you so much. Thank you.
Thank you so much, sir. Dr. SUMIT Singh, Chief Neurology at Artemis Hospital, Gurugram. Thank you so much, sir, for joining us.
My pleasure. Thank you.
Thank you, sir. Dr. Joy Desai, Director Neurology at Jaslok Hospital, Mumbai, and Consultant Neurologist at Sir H. N. Reliance Foundation Hospital and Research Center. Thank you so much for joining, sir. It is a pleasure to have you.
It's mutual. My pleasure too.
Thank you so much, sir. Surgeon Commander Dr. Dipendra Singh, Consultant Neurologist at Command Hospital, Kolkata. Good evening,
Good
sir,
evening.
and thank you so much for joining.
Good evening, everyone.
Thank you, sir. Dr. Lieutenant Colonel Rahul Soni, Consultant Neurologist at Military Hospital, Sikandrabad. Good evening, sir, and thank you so much for joining.
It's my pleasure. Thank you so much.
Thank you, sir. Now, to begin our discussion with, which is about migraine beyond headache, epidemiology, awareness, and early recognition. And to set the context, I would request and ask my first question to Dr. Professor Manmohan. Sir, migraine is frequently perceived as routine headache. How would you describe its true clinical and societal impact today in our country?
Headache, to start with, I will say it's very common. It's one of the commonest malady of the world since ancient times. Migraine is often mistaken for that this must have happened कि हम किचन में काम कर रहे हैं उसके धुएं से हो गया होगा, धूप में गए तो उससे हो गया होगा, कुछ स्ट्रेस हुआ, फास्ट रखा तो उससे हो गया. But on the other hand, migraine has very typical characteristics. It occurs usually in 25% of women and 8% of men. This can lead to loss of man days if not diagnosed early, treated early, and I will say when it occurs, terminated early. These are very important aspects and one must recognize this. Now to start with, I will say headache usually in migraine is on the one side, this side or the other side, half of the head. It's throbbing in nature. How do we ask the patient? Patient may not know what is throbbing. One of my doctor asked somebody that, is it throbbing? They said, oh, what's the throbbing? I don't know. Throbbing is like the heart throb. Sometimes we are under stress. So it's like, or bursting headache. So those are the characteristics and it lasts usually few hours. And sometime before this, there can be some blurring of vision, or as if the insects are flying in front of the eyes, or it is called fortification spectra, which can be multicolored. And thereafter, the headache starts building. Now, before it builds, we have to stop it there. And thereafter, once it builds, person may have vomiting. Now, the common feeling which most of the patients say, they feel like banging their head on the wall, or they say head should burst. With the vomiting, they get good relief. So these are typical characteristics of the migrainous headache. There are different types. I think as question comes, we will discuss with aura, which I said, fortification spectra, or black spots, scotoma, and the other is without aura. And it can occur at various frequency. One of the common in women is it can occur during menstrual cycle, which must be asked by the doctors and also informed by the patient concerned. So I think I then will take up further. There I think that was my answer to the question which you asked, Simranji.
Yes, sir. I think you have explained this very well in a very simple language, sir. I think this will definitely help our audience to understand what exactly is migraine, what are the signs and symptoms, and how do we sometimes ignore it, and a better understanding of this. Building on that, my next question is to Dr. Sumit. So, which misconception about migraine continue to create a challenge in the timely diagnosis and effective management, according to your experience when you treat patients and that they come to you?
Yeah. So I think as Dr. Mehndiratta just now said, the biggest conception is पेट की गैस थी सर पे चढ़ गई. Now people think that gas is something which is going into your head and that's causing the migraine, whereas actually it is the prodromal phase of migraine. तो migraine की वजह से गैस होती है, गैस की वजह से migraine नहीं होता. So there is a transient gastroparesis, which means decreased movement of the gut, which happens just before migraine is about to happen, and that causes migraine. Then there would be people who would be saying, डॉक्टर साहब नॉर्मल टाइप का सर दर्द होता है. अब मैं उनसे कहता हूँ भाई या तो तुम नॉर्मल हो या तुम्हारे को सर दर्द है. You can't be having a normal headache. So every headache which has been happening in the past when the patient comes to me has been actually migraine. So the migraine frequency can vary. You can have one headache in a year or you can have one headache a day. It is not the frequency of headache which tells that it is migraine. It is actually the associated features. So an episodic headache, which is lasting from 4 hours to 72 hours, is associated with a dislike towards bright light and sounds, or nausea and or vomiting. And there is nothing else which can explain that headache is a migraine, whether it is once in a year, once in a month, or once in a day. Now, important thing is that when we ask this question from our patients, we often use a little scientific terminology. हम बोलते हैं आपको फोटोफोबिया है या नहीं, अब उसे क्या पता फोटोफोबिया क्या होता है. So they would say, I feel comfortable when the lighting is dim. And over a period of time, these patients, they understand कि light dim ही रखनी है तो मैं comfortable रहूँगा. So what they will do, they will usually change the room light so that it is always dim. And then you ask the question, do you have photophobia? They would say, no, I don't have photophobia. You ask them कि do you have phonophobia? नहीं नहीं अब मुझे तो नहीं होता. फिर मैं बोलता हूँ जब आपके बच्चे चिल्लाते हैं, जब तेज म्यूजिक चलता है कमरे में, आपको कैसा लगता है? नहीं नहीं मैं नहीं टॉलरेट कर सकता. How do you feel during a headache? मेरा तो मन करता है बस तकिया सर पे रखूं, लाइट बंद करूं और सो जाऊं. So they would like to lie down in a quiet room and move as little as possible because they know that during the headache their activities are going to worsen the headache. So the biggest problem is that patients don't understand that you are either normal or you have a headache. So they would say कि अब मेरे को माइग्रेन होने लगा, पहले तो मेरे को नॉर्मल हेडेक होता था. And then the second problem is the concept of treatment. They always want a cure, whereas we all know that migraine is not a curable disease. We only know that it is controllable. So they come with a target कि मुझे ठीक होना है, मुझे दवाई भी नहीं खानी है, मुझे सर दर्द भी नहीं होना चाहिए. So that is, according to me, the biggest gap in the diagnosis and approach to patients with migraine.
So very well explained in a very layman language, ताकि हमारी ऑडियंस तक ये मैसेज बहुत क्लियरली चला जाए कि क्या चीज़ें हैं जो वो इग्नोर कर रहे हैं, क्या चीज़ें हैं जिन पे उन्हें ध्यान देना है. एंड like you said, it is controllable, not completely treatable. So I think they should be ready with this mindset when they are coming to a doctor कि ट्रीट करने का या कंट्रोल करने के लिए दवाई तो खानी पड़ेगी और जो लाइफस्टाइल रिकमेंडेशंस बोले जाएंगे वो तो करने ही पड़ेंगे. So thank you so much, sir, for explaining us that. Moving on to my next question to Dr. Joy. So, despite increasing awareness and so many, awareness session going on where doctors are putting efforts, for creating this awareness, how widespread is the issue of undiagnosed and inadequately treated migraine, particularly in India and similar healthcare settings also?
So, when you talk about how widespread this is, you can take a common example that we discuss with our students when they join our neurology team, is that if you put 5 people in a room together, out of that 5, at least one, often 2, have had migraines at some point in their lives. And I can see my colleagues and friends nodding their heads that that's the case. So you can imagine that if 2 or 1 people out of 5, you're looking at numbers of 20 to 40% of people have had a migrainous headache at some point in their lives. Now, the other question you're asking is how often is it difficult to treat and how often do they come to a tertiary clinic? That can be very variable. But one way of looking at migraine, at least the way I see it as a clinician, is that it is your brain trying to tell you that it needs better treatment. Because a migraine is precipitated by something internally or externally that is not allowing your body's equilibrium to be calm. External things could be pollution, very high heat, a lot of noise, smog. Um, Internal things can be stress, bad sleep, underhydration, and not having consumed food on time. Now, these are all the common things that can trigger off in a susceptible person a headache. And that headache will have all the characteristics that Dr. Sumit mentioned. One half of the head, sensitivity to sound and light, nausea, sometimes giddiness. And once in a while, you'll always see someone who is also so more giddy than they have a headache. And women, especially, sometimes never talk about their headaches. They only talk about giddiness. So they'll end up in giddy clinics in the ENT room and talk about dizziness. But when you ask them that with the dizziness, do you have a headache and are you sensitive to sound and light? Then often that giddiness is a part of the migraine. So it's a very common problem. Having said that, if one is able to harmonize internal and external um, biological equilibrium, internal equilibrium with self, external equilibrium with the environment, then you're less likely to get headaches even if you have a strong family history.
Thank you, sir. Thank you so much for explaining this. And I think that what you said is we normally do not understand the conceptions, and I think that's what make us understand what exactly is the issue, and that delays the treatment as well. Um, even with the awareness, the kind of awareness we are, and the kind of awareness we are trying to make. Building on that, I would ask my next question to Dr. Dipendra. So, early recognition remains the first step towards the better outcomes. We all know that. But what are the key for early indicators that healthcare professionals and patients should recognize to enable earlier intervention?
Yes, definitely. Uh, as far as migraine is concerned, there are various key indicators, predominantly to focus on prodrome, like premonitory phase, which usually occurs hours to days, often up to 48 hours before the headache starts. So these non-headache symptoms highlight that migraine is a complex neurological disorder. So why this understanding of this early neurological disorder matters? Because it affects around 15 to 50, 14 to 50% of global population, affecting mostly the women and among working age adults. And awareness of migraine beyond headache include prodrome, aura, associate symptoms, like which reduces the underdiagnosis, stigma, and progression to chronic form. So, what are these pre-prodromal symptoms, or that is early warning symptoms, which the patient vis-a-vis a doctor are aware, so that we can diagnose and treat the early as far as migraine, early as far as migraine. Like about if 80% of migraines जितने experience they produce prodromal they experience prodrome symptoms like neuropsychiatric cognitive symptoms like fatigue, yawning, mood change, irritability, difficult to concentrate, any sensory sensitivity like photophobia, light sensitivity, and like sir has already explained, autonomic or gastrointestinal like neck stiffness, pain, very common. Food cravings, definitely, loss of appetite, thirst, increased urination. All these are prodromal symptoms. Others include like dizziness, fluid retentions. These are the prodromal symptoms, and definitely aura, which occurs in 25 to 30% of migraine patients, like visual disturbances, seeing a flashing light, zigzag light. Patient comes to the OPD, वो बताते हैं कि सर मैं बैठे बैठे जब उनको हेडेक होता है तो उनके आंखों के सामने लाइनें आती हैं, जिग जैग लाइन आती है, इसको अचानक से आंखों के सामने काला धब्बा आ जाता है, उनको झुंझुनाहट होती है, टिंगलिंग होता है, या फिर समटाइम्स दे हैव स्पीच डिफिकल्टीज आल्सो, दे हैव these kinds of problems. And so how we can recognize, how healthcare professional and patient can recognize and act early to prevent and to know the headache that they are going to suffer. So for patient, what they can do, they can keep a headache diary, like tracking symptoms, timing, trigger, and patterns, whether it's sleep, whether it's stress, whether it's hormone, or whether it's weather. Recognize personal prodrome, pattern to act early. They can act early. And for healthcare professional, how we have to recognize early, we have to maintain the diagnosis. We have to know the diagnosis, what is that, and we have to rule out other secondary causes which can, and why the red flags like thunderclap onset. Sir has already told new onset after the a new onset headache after the age of 50, any fever, any patient is having any कोई उसको problem होगी, that is means any focal neurological deficits. So raising awareness through education, reducing diagnostic delays, and viewing migraine as a brain disease, identifying the early recognition, that epidemiology and the aura regarding the migraine, which helps in early diagnosis and management of the disease. So I think key early indicators are very much required to diagnose the disease and prevent the subsequent disabilities and the higher global burden of the disease.
So very rightly mentioned, and I think by maintaining what you said, a very important part, by maintaining a diary and noting all the symptoms or and noticing when it is triggering, I think that will be really helpful for the patient and as far as for the doctor also, to recognize and understand when this is happening and what to avoid in such cases. I think that is a very valid option and a good thing mentioned by you, sir. I think that would really be beneficial for our audience also and
After screening all
patients.
these symptoms, they can do to like they can take rest, go to dark space, they can take medication, they can hydrate themselves. So these are important to identify early indicators for migraine.
Thank you so much, sir. Thank you so much for stressing on these important aspects. I would like to take my next question to Dr. Rahul. So, many individuals continue living with migraine symptoms for years before seeking specialist. Maybe by ignoring the symptoms, or maybe just taking some medicines from here and there and not taking that seriously. So, despite experiencing symptoms for years, many patients delay seeking the specialist care. What factors contribute most for this delay in your experience when you hear patient stories when they come to you after so many years?
First of all, I will confirm Desai sir. He has correctly said among five, one will be a migraine patient. So I am a migraine patient. My mother is a migraine patient, and my both kids are since the age of 6 years. They are migraine patient. So migraine is very common, and as correctly said, uh, because symptoms are like that, it's always people see that it's just a headache. सब सरदर्दी तो है ना. They don't want to characterize it as a migraine. Migraine नहीं बोलना चाहते. The problem is that for this, just like headache, they go to the nearest pharmaceutical shop and they take any medicine. And most of the time, the over the drug is aspirin khali sab, या Combiflam khali, the brand names which are very common. So the problem is that they keep on chewing all these medicine which are over the counter is easily available, and which lead to medication overuse headache. There's underlying headache is there, and when the getting over the counter drug very easily available, then they complicate the disease and they come late. So when they come to us, like they come with us with a 5-year 6-year history of सब headache हो रहा है और ठीक ही नहीं होता, पहले तो कभी कभी होता था महीने में, अब तो ये हालत है कि रोज आती है. और sometimes the people are that they take more than 15 or 20 days any type of NSAIDs, जो भी पेन किलर्स होती हैं वो खाते रहते हैं. So this is a very common problem, and but the problem is that it is we should differentiate between there's two problems. One is systemic, and another is behavioral issue. First, systemic issue is that our system of medicine distribution like that, anybody can go to any pharmacy shop and get any medicine. So people with just like headache, they go and they take the medicine, and for next 4-5 days they take a complete strip and they are comfortable with that. Second thing is that there's for the normal physician, I am telling you, not just a local practitioner, there's a little bit confusion over different type of headaches. Most of the time migraines are associated with that because the overlying daily headaches, they are associated with the tension type headache, but few people have only tension type headache. So how to differentiate between a TTH and other type of secondary headache from migraine, it is required, and this is lacking at the level of general practitioner. So most of the people, they require neurologists or headache experts, I think I can say, those who have an exposure of headaches clinics and all the thing. So third thing, as I told you, second thing is the behavioral thing. Behavioral thing means there's a called term therapeutic nihilism. अरे साहब होगा क्या, वो भी तो दवाई देंगे दर्द की, मैं पहले ही दर्द की दवाई ले लेता हूँ. और फार्मास्यूटिकल शॉप वाले वो भी यही बोलते हैं कि साहब यही दवाई देते हैं आपको और यही दवाई लीजिए, उसके अंदर आपको ठीक हो जाएगा. If the patient is having a frequency of more than 15 headache per month, it's a significant headache, and it converts to chronic migraine. The problem is that the headache is not a headache. It affects your work performance. आप काम नहीं कर सकते. किसी भी व्यक्ति को एक महीने में 15 दिन सर दर्द है तो how will he perform? Even I have a headache. Whenever I have migraine headache, it's very difficult for me to work. But I take medicine or whatever, so I take a proper protocol, and I take whenever I am in aura, as Dipender say, I take medicine and I continue my work. The problem is that all the person who are especially involving in the brainstorming work, so they require, once they go into aura, it's just like 4 to 72 hours, they are off. Their efficacy is gone for 6. So these two things like systemic and personal thing I will take consider कि ये दोनों चीज बहुत इंपॉर्टेंट है. ये भी किसी पेशेंट को हमें प्रॉपर्ली असेस करना है और इस सिस्टम को बेसिकली हमारे सिस्टम को इम्प्रूव करना है.
सर जैसे कि आपने बताया कि एक इंसान को जब माइग्रेन होता है तो वो सिर्फ उसका सर दर्द नहीं होता, वो उसकी एफिशिएंसी पे भी कितना इम्पैक्ट डालता है, विच वी नॉर्मली इग्नोर. और जब हम अपना सर दर्द इग्नोर करते हैं तो कहीं ना कहीं हम अपने काम के साथ हैम्पर कर रहे होते हैं, कहीं ना कहीं घर की बहुत सारी चीज़ों के साथ हैम्पर कर रहे होते हैं. आई थिंक दिस गिव्स अ वेरी क्रिटिकल एंड क्लियर मैसेज टू ऑल आवर लिसनर्स कि one, to keep a note of what triggers you. Second, never delay your treatment. Never take over-the-counter medicine without consulting your doctor, neurologist, specifically in case when you are diagnosed with migraine. So I think some protocols needs to be followed if you want to live a healthy, happy life, complication-free life, and like triggers are a little bit manageable. Migraine itself is controllable. So I think things when done in a proper way, systematic way, we can manage things, and with the help of clinicians and the experts we have. So on that, I would just like to take one question we have from audience. I will just quickly take, since we are talking about the symptoms and medication as well. I have one question that my mother has suffered from migraine for years, but now that she is getting older, her symptoms seems different and headaches are less frequent. Can migraine symptoms change with age? Dr. Rahul, if you could answer this.
Yeah, definitely. Definitely what he is saying that over a period of time, because initially the migraine also has definitely several pattern of migraine, like as the speakers has told. There are different types of auras also, but over a period of time, when we continue with the migraine headaches, that there's a overlap of the symptom with the tension type headache also. People are afraid because whenever they are exposed to bright sunlight, their past experience कि मैं धूप में जाऊंगी या मैं व्रत करूंगी तो मेरे को migraines precipitate होगा. It's a fact because there is a fluctuation in the blood sugar level. It precipitate. When there is a heat precipitation, then it will affect the. Basically, if you see conceptual wise, ना यदि मैं concept पे बताऊं, migraine is nothing but there's a your body's response to external environment. Any change to your sleep pattern, your caffeine level, your alcohol level, your smoking level, anything which are your body is accustomed. If it change in that, you will have a migraine. If I am drinking a cup, 5 cup of tea and morning 2 cup tea I escape, I will have a migraine. So this is the concept. So it's a body's response. Like asthma is the response of the all pollution allergen. It's a response to your body. If you have an impaired sleep. So what happened? The chronic migraine, in the long-standing migraine, the patient develop tension type headache overlay, and then it's very difficult to treat because they are afraid of migraine and they are whatever they are taking treatment. It sometimes requires and sometimes more drugs are also required. So I should say कि if they are confirmed they are यदि उनको पता लगी क्या है migraine, they should take proper medication from some neurologist.
Thank you, sir. Thank you so much for this advice and for answering this question from our audience. I would like to take the session ahead, and our focus now will be advances in migraine sciences, science and precision therapies, which is available. I would like to take this question from Manmohan sir. So, over the past decades, migraine science has evolved remarkably from better understanding disease mechanism to introduction of the targeted therapies. So, how has our understanding of migraine biology and disease mechanism advanced over the past decades?
Very, very important question, and I must say, very pertinent question. The neurological science has become from passive branch to dynamic branch. There has been so many advances in the field of migraine. But before we go, I always ask my patient that since how long you have headache? सर हमने MRI करा लिया है, सर हमने CT भी करा लिया है, सर दवाइयाँ भी बहुत खा ली हैं, कोई फर्क नहीं पड़ रहा. Then I also ask them, जैसे हमारे colleagues ने mention किया कि कितनी बार होता है, how frequent in a month, number one. Number two, how severe. I ask them one example, like a teacher gives marks in the school. 1 is minimum, 10 is maximum. We call it as a visual analog score. On that you give marks to your headache because accordingly treatment will depend. Now, as far as treatment is concerned, like somebody say 9 out of 10, that means very severe headache, which may be very disabling. So the science now says, if you have headache, start with simple analgesics along with some antiemetic, and I tell my patients that's very important. You have headache here, start it here. Don't wait till it goes here. Then the medicine may not affect. We have around 15 medicines which can terminate the acute headache alone or in combination, number one. Number two, then we have preventive medications. Some have got very high level of evidence, which by and large called beta blocker कहते हैं उनको, वो दे सकते हैं provided कोई contraindication ना हो, और वो हम usually twice a day देते हैं. बट इवनिंग में मैं उनको कहता हूँ 4 या 5 बजे ले लें, 8 बजे ना लें, कई बार उससे ड्रीमी स्टेट होती है. इसी तरह से सपोज देयर इज ए पर्सन who has migraine and who is well built or heavy and is obese. In those cases, SUMIT has done a study also that we can start with another medicine which can take care of migraine as well as the weight. Then thereafter, once these things are there, then in women, if it is during the menstrual cycle, very important, and like the earlier gentleman asked, the headache is now decreasing with age. By menopause, by and large, headache subsides. But some people may have postmenopausal de novo headache. Now, those who have headache during menstrual cycle, in those who have a medicine called acetazolam, not in the trade name because we are not supposed to promote. So acetazolamide, we are say, okay, your cycle is 3 days. You start feeling a day before. Start a day or two before. Take over during the cycle and 1 day after. So 5 to 6 days, one tablet morning, one evening. That will reduce the pelvic congestion as well as the inflammation process in the brain, which causes headache. So these are some of the medicines which are available. Then we also have injections available once a month. Different concentration comes 70 milligram and 140 milligram. And I have patients from, my all colleagues must have patients from international, coming from Northeast, who are under this injection once a month. Very easy. They can give even at home. After the first injection, they have seen subcutaneous. And this has been found to be very effective. Then after that, we have Botox. Now, Botox, most of the people know for beautification or for certain purposes which is used. So Botox also we give. We had a conference last year, and I think Sumit, I asked him, he did the commentary on that. So it is like given at 31 sites in the headache on different position, 5 units each site, around 155 units, and this has very good result. The next one, there's a block on the backside. There's a nerve called greater occipital nerve. We can do the block. Now there are good number of neuromodulators also. As you said, the science has changed. The science has advanced tremendously, and then we have neuromodulation like putting on the arm. Whenever there is this, then there is a signal goes and inhibits the pain-producing structures. So that can be very helpful. Up to this level, I think I'll stop because then my other colleagues can contribute. But these are the main highlights which have happened in last decade, especially the injectable. There are many types of injectable, not only one. Some are available in India, others are not available yet. But they are becoming available. So with this, I think I'll hold on and hand over the mic to Simranji. Thank you.
Thank you, sir. You have explained this very well, and the treatment options available, the medicines, and how we can, manage our symptoms and the headache, which is very important. Thank you so much for shedding light on that. I would
One
like to
thing I
take my
will
next
say,
question. So,
Simranji, can I come in? One thing.
sure, sure.
We, as Sumit said, we tell the patient that you have headache for 9, 10 years. Give me at
So,
least 9 months, 1 year to break the cycle.
so,
And you have to take it regularly, not that you take once a while. You have to be compliant. Normally these are safe. If any adverse effect हमारे पास आई है, कोई साइड इफेक्ट हो तो, पर इसको अपने आप बंद मत करिए। मैं ठीक हो गया। किसी को डिप्रेशन है तो हमारे पास ऐसी भी मेडिसिन जो हम रात को देते हैं, जो डिप्रेशन भी ठीक कर सकता है और माइग्रेन भी ठीक कर सकता है। थैंक यू सो मच।
thank you, sir. And I think the discipline is required from the patient's end as well. If the doctor has said something, that has to be followed, consistently. Thank you so much, sir. I would like to take my next question, Dr. Sumit. So, CGRP targeted therapies are being regarded as one of the biggest advances in migraine treatment. With the emergence of CGRP targeted therapies, how do you envision their integration into everyday migraine care for patients?
देखिए CGRP तो एक केमिकल का नाम है. It is just a chemical name. You can call it PGRP, you can call it DGRP. It is one and the same thing. It's all Latin and French for the general population. What is important to understand is that till now we were borrowing treatments from different specialities. We were borrowing drugs like topiramate from the epileptologists like Joy. We were borrowing beta blockers from cardiologists. We were borrowing anti-amitriptyline and other SNRIs or SSRIs from the psychiatrists. We didn't have a migraine-specific treatment. Now, over a period of time, as Dr. Mehndiratta has said so beautifully, that we have come to understand the science of the causation of migraine. So basically, in a nutshell, one has to understand migraine hota kyun hai. So, in a single line, if I have to put it, I would say that in a genetically predisposed individual, on exposure to certain triggers in the environment, there is release of certain chemical mediators of inflammation inside the brain. of which today we know that CGRP, calcitonin gene related peptide, which is a small protein, is probably the most studied one. Now, जैसे ये CGRP नाम का केमिकल ब्रेन में निकलता है, it causes a sterile neurovascular inflammation. तो ब्रेन की जो नर्व्स और ब्लड वेसल्स होती है उन पे एक सूजन टाइप की आती है. This swelling causes stretching of the blood vessels of the brain, which is perceived in the brain as headache. So ये पूरा पैथोफिजियोलॉजी है माइग्रेन का एक लाइन में. So now we understand that CGRP is probably the most studied chemical which is causing migraine. So अब हमें ये पता चल गया कि माइग्रेन ब्रेन में हो क्यों रहा है. So अब हमें ज़रूरत नहीं है कि हम वो वाली थेरेपीज दें जिससे CGRP इनडायरेक्टली मॉड्यूलेट होता है. हम टोपारामेट देते हैं, उससे कुछ ब्रेन के केमिकल्स मिलियो जो है वो चेंज होता है और इवेंचुअली CGRP का प्रोडक्शन कम होता है. हम बीटा ब्लॉकर्स देते हैं, उससे गाबा का पाथवे स्टिमुलेट होता है, उससे CGRP कम होता है. हम लोग एमिट्रिप्टिलिन देते हैं, उससे ब्रेन के सोडियम चैनल्स ब्लॉक होते हैं, उससे CGRP कम होता है. बट हमारे पास टारगेटेड ट्रीटमेंट्स हैं जो डायरेक्टली CGRP या उसके रिसेप्टर्स पे काम करते हैं. And these are two types of drugs. One are the long ones, which are the injectables ones, which Dr. Mehndiratta sir rightfully said, which are once in a month injection. And then we have short lasting molecules, which you can take up to alternate day. So both of these molecules are now available in India. The problem is their cost. So we have targeted therapies available. We should ideally offer them to all people, but we cannot because of the prohibitive costs. So अगर जो किसी को माइग्रेन है, चाहे उसको महीने में एक दफ़ा है, चाहे उसको महीने में 15 दिन है, if affordability is not an issue, then anti-CGRP molecules should be the first modality of treatment offered to an individual. But हम वो नहीं कर पाते. वो इसलिए क्योंकि हमारे यहाँ इंश्योरेंस में कवरेज नहीं है ट्रीटमेंट की, और ये जितनी भी ड्रग्स हैं वो बहुत एक्सपेंसिव है. So what we do is we start with drugs like Dr. Mehndiratta sir said, beta blockers, or we give topiramate, or we give botulinum toxin in once in a 3-month injection. If it was possible, and across the world, these drugs, the anti-CGRP molecules, are the treatment of choice, even to initiate treatment for migraine.
सो थैंक यू सो मच सर. आई थिंक जिस तरीके से आपने हमें बताया एग्जैक्टली टू अंडरस्टैंड कि माइग्रेन, सबसे पहले तो समझने की बात है कि वो होता क्या है, क्या कैसे चीज़ें बढ़ती हैं उसमें, एंड देन हाउ थिंग्स कैन हेल्प, हाउ द मेडिकेशन कैन हेल्प, हाउ द एंटी CGRP थेरेपीज कैन हेल्प, एंड व्हेन टू यूज इट, एंड one of the important factor which you mentioned about, which is affordability. So I think that is another important factor which you stressed on. Thank you so much for stressing on these factors, sir. I will move on to my next question to Dr. Joy. So, personalized medicine is transforming for many specialties. To what extent is personalized or precision-based treatment is shaping the future of migraine management?
Yeah, that's very enigmatic question. And it's a very romantic thing also that we use the word precision and we use these words personalized. But you've got to understand that any migrainer who comes to the clinic will have their own individual triggers, internal or external, that is responsible for perpetuating their headaches, because they have not understood कि इस कारण से मुझे हो रहा है. And actual personalization lies in taking a very good story, understanding how the person is living their 24-hour schedule. Often this is something that is missed. What time do they wake up? What time do they sleep? Do they have time for exercise? How much water are they drinking? Do they eat their meals on time? Are they working in a manner where they are often stressed? It's an important thing to ask. We ask all our patients. And are they? Do they have some time for having fun? Because that's also an important thing which is going to downscale how they are. So we have this understanding, which all my learned colleagues will bear out, is that if you have a type A personality, that means you are very goal driven, you are very perfectionist, you demand perfection from self and you demand perfection from the world, then very likely you will have headaches. And we call that the type A personality. But we know commonly in the clinic that people with type A personalities, very difficult for them to let go either of themselves or the rest of the world. And that's often a driver. So when we talk about personalized medicine, I look at it as a clinician that we need to give enough time to our patients and understand who's the human behind the headache. And if we can guide that human to overcome their drivers, then we'll go somewhere. And we did a study in Jaslok with my student who just passed out, where we looked at all our very difficult migraineurs who had seen other people and then came to Jaslok. And we were trying to understand what is the commonality in their lifestyle parameters, and we looked at everything. And the commonest thing we found is disruption of sleep timings. So if you sleep late and you wake up late, that seems to be the single common. We presented this in one of the national meetings as well as a brief paper, because in urbanized times, the brain is wired to sleep 4 hours from sunset by about 10:30, and I'm hoping you'll allow me to finish by 9 today. And the brain wants to wake up with the sunrise. And how many people are actually sleeping on time at 10:30 or quarter to 11 and waking up at 6:30 or quarter to 7? That itself is a very big driver. Circadian misalignment, we call it. It's a kind of Latin sounding term, but what it means is कि हमारा दिन और रात में क्रिया करने की जो स्केड्यूल है वो बाहर के दिन और रात से जुड़ी हुई नहीं है. तो जब हमें ब्रेन सोना चाहता है तब हम जाग के कुछ काम कर रहे हैं, और जब हमें सुबह में उठ के जल्दी सुबह में कोई कार्य करने हैं तब हम सो रहे हैं. So that's a very big driver. Just misalignment is a very big driver. So when we talk about personalized medicine, I don't think we should think about very complex genetics and doing very fancy evaluations on blood markers and using the buzzword for today like proteomics. I think we have to break it down to very simple: who's my patient, who's my human behind the headache, and how can I help that human function better. So I think, and a lot of difficult headaches also, if we can get them to cooperate and manage their lifestyle, they all settle down. And ultimately, you can get them down to lesser number of medications, lesser number of headache days. So you heard doctor say that, Dr. Soni said that, Rahul said that he's a migrainer and his parents are migraineurs. Well, in my family, my mother was always a migrainer. My sisters were all migraineurs. I had migraines when I was in med school, but I've not had a headache for 25 years. So from the time that you can manage lifestyle, I think even if you have the genes, your body behaves. So I think it's an important message, and I want my people, patients who are listening, and individuals who are listening here to understand that if we treat our bodies and brains right, I think sleep is a medicine, water is a medicine, disciplined timing with food and disciplined consumption is a medicine, and mindfulness is a medicine. If we can, and exercise. We have these 5-6 things in our lives. If we manage those, then that itself can reduce the degree of migraine burden. Of course, then we have medications and we have specialists and we have CGRP antibodies. We all have that. But this is equally important.
Very rightly mentioned, sir. And I think what you said at the start is we have to treat the human behind the headache. And I think that's what our question was to, how we can make use of personalized medicine, how personalized medicine, precision-based medicine is there to help you. And like you said, when we target the factors which is contributing to it, whether it is sleep, whether it is food, whether it is, the kind of lifestyle habits we have, we can reduce the number of medication, we can reduce the number of interventions, and which will definitely help us to reduce the number of migraine incidents in a person's life experience. Thank you, sir. Very well explained on this. I would like to ask my next question to Dr. Dipendra. So, as we just spoke about the personalized medicine and the advances which is there, now it's time to speak about technology, which is also playing an increasingly important role in neurological care. So, how are advancements in imaging, biomarkers, and digital health tool enhancing the diagnosis and monitoring of migraine?
Uh, yeah, definitely. As we know, for the diagnosis of migraine, actually, routine imaging is not required for typical migraine. But in this current era of AI, like in which we are living, advancement in imaging, biomarkers, and digital health tool, what you have asked, are definitely shifting migraine from purely clinical diagnosis to more precise, objective, and proactive model. These things not only support earlier or accurate diagnosis, but better subtype classification. We can give personalized treatment. We can do real-time monitoring. We can prediction of attacks, and ultimately reducing disability and progression to the chronic migraine. So I will start one by one. I will first take what are the imaging advancement that we have achieved in the field of migraine, like functional MRIs, diffusion tensor MRIs, ultra high definition MRI, 7 Tesla MRI, or magnetic encephalograms. They basically what do functional MRI? They identify biological subtypes, like one with the greater cortical, subcortical blood flow in the brains when we study the pathophysiology of the migraine to severe attacks, who are going to have more attacks. And we can go into we can know the mechanical insights of the migraine. Studies have shown like diffusion tensor images. They do the oscillatory edge connectivity in the pain related areas in the pathophysiology of the migraine, that the trigeminal system, somatosensory or insular region, there is a more blood flow during the attack. So all these machine learning on these features achieve good accuracy in distinguishing migraine from controls or other kind of headache. We can definitely differentiate. So now coming on to the biomarkers, that we have seen the imaging advancements in the current era. Now coming on to the biological biomarkers like CGRP and related pathways. Like sir has already told, in this current era, if we have to treat migraine, why not treat with the acute anti CGRP agents? But plasma CGRP, what we monitor as a biomarker for the migraine, has a role in pathophysiology and a therapeutic target. But there is a challenge with this level and monitoring for the migraine patients. And besides that, in current era, biomarkers complement rather than replace clinical diagnosis. And as far as new things to diagnose, to monitor, various digital health tools, the third aspect of the questions, like digital health tools are available. They are wearable apps, AI, and connected devices. They are transforming monitoring and prediction by capturing real time world longitudinal data, like attack triggering and tracking and triggers. Apps like Migraine Me, Heaven, they often tap logging, any trigger correlation, any decreased sleep, any stress, or any barometric pressure, any hormonal diet change. They produce medication effectiveness analytics and doctor ready reports. Many integrate, like we are the wearables for objective data and attack triggering and tracking. We have more biometrics like heart rate variability, sleep activity to forecast risks when we are going to attack. These are the apps which helps in digital therapeutics and wearables like Nerivio, which is easily available nowadays in India. They provide accurate and preventive reliefs with sustained long-term efficacy. Approximately up to 3 years, they provide feedback. Smartphone apps, like they are when you have to do the relaxation, they have to do progressive muscle relaxation when you have to take the sleep, reduce disability, and they are very important. They are producing a broader impact nowadays. In more precise, objective, and proactive models are available for the treatment, for the diagnosis, and definitely characterization of the migraine. So these tools collectively enable early intervention for identifying prodromes, patterns, confirming diagnosis, how we are going to monitor, how we are going to treat. So this is definitely important in this current era. So advancement of in imaging, biomarker, and digital health tools are definitely shifting the management of migraine in this present era, I think.
Thank you, sir. Very well highlighted that how things are working into this direction and how they are helping us in terms of managing migraine care. Also, as we are talking about the advancements and innovations and how the wearable tools are helping us in managing this, we know that treatment goes beyond medication alone. So my next question is to Dr. Rahul. So beyond pharmacological treatments, which evidence-based lifestyle and behavioral intervention have demonstrated meaningful benefit for migraine patients?
Yeah, thank you so much. This is very important question. Migraine is not a per se disease; it's a lifestyle disease. Any change in your lifestyle will precipitate a migraine. As Dr. Desai correctly said, I generally said जब भी पेशेंट आते हैं तो बोलता हूँ ये तुम्हारा बीज है और वो उसका पेड़ है माइग्रेन. बीज क्या है? सीड. I generally use the abbreviation seed. Seed as for sleep hygiene. यानी आप टाइम पे सोइए, टाइम पे उठिए. एक्सरसाइज, रेगुलर एक्सरसाइज, एटलीस्ट हफ्ते में 3-4 बार 45 मिनट्स यू डू एडवांस और मॉडरेट योगा और एक्सरसाइज. देन ईटिंग हाइजीन, बट टाइम पे खाइए. टाइम पे खाइए यानी मतलब ब्रेकफास्ट, लंच, डिनर, वट एवर टाइम शूट्स यू, यू टेक टाइम ऑन दैट पीरियड. Because any sudden hypoglycemia, overeat fasting, over binging, over alcohol, over smoking, everything will precipitate your migraine. Then fourth is your diary taking. Your dietary things is very important. What food suits you or what food doesn't suit you. Suppose if I am a roti eater or I am a normal Indian food eater, and if I have been forcefully given pasta, pizza for next subsequently 3 days, I will precipitate migraine. This is how migraine happens. So dietary habits, then stress management. As I told you since beginning, stress is the overlay of any migraine. Migraines are most of the time when it's a kind of chronic patient for 1 year, 2 year, or when the frequency they are associated with the stress. So these 5 points has to be make understood to all the patient. आप जब तक उनको समझाएंगे नहीं तो second thing I stress on most of the patient, like which the things our ancient science we have lost it or we don't want to enumerate, because this now modern medicine is driven by pharmaceutical company. And I just give yoga. Yoga is the best thing which can yoga and meditation. Yoga has been already a content trial was done in I think AIMS, and they have proven that there were definitely benefits on when the patient with the migraine is having a baseline some medicine, but if it is add on yoga, it will benefit it. And meditation, I give you very, very, very good example. We all know that Vipassana is the long chain of meditation center. If you see Mr. Goenka, the owner of that Vipassana, or who started Vipassana in India, he was a chronic migraine patient worldwide. He got a treatment, America, everywhere. But ultimately, when he started doing meditation, his headache gone. And I've seen that patient. 15 to 20 minutes every day meditation and yoga will definitely help. These are the lifestyle changes which I prefer and I advise to my patients. Then another thing is cognitive behavior therapy. Cognitive behavior therapy, you need to give positive reinforcement to the patient. समटाइम पेशेंट विल कम, साहब दवाइयाँ सारी ले ली, अब तो कुछ हो ही नहीं रहा, मैं उनको भी दिखाया था, मैं दिल्ली में दिखाया, यहाँ दिखाया, वहाँ दिखाया. पीपल ट्राई टू इंट्रोड्यूस कि मैं ये बड़े हॉस्पिटल छोटे हॉस्पिटल में गया, मेडिसिन आर मोर लेस सेम. एवरी न्यूरोलॉजिस्ट एवरी बिग गिव मोर लेस सेम. आज मैंने एक दवाई दी है तो दीपेंद्र कुछ चेंज करके तो टोपराम, मैंने बीटा ब्लॉकर दिए तो दीपेंद्र टोपरामेट कर देगा इफ इट इज नॉट रिस्पॉन्डिंग. बट द प्रॉब्लम इज दैट की पॉजिटिव रीइंफोर्समेंट, cognitive behavior therapy is very important in migraine patient. You have to positively say दवाइयाँ वो भी अच्छी थी, ये भी अच्छी है, वो आपको सूट देगी, ये आपको सूट करेगी. That is the more important. So I think that 30 to 40% medicine work, but the rest of things is most important than medicine part. It is my way of thinking, taking a migraine.
So you mentioned very clearly how things work when it comes to lifestyle management. The abbreviation you used, SEED, I think that is very self-explanatory. How things can work in right direction if you can take care of your sleep hygiene, if you can take care of your eating habits, if you can take care of, I'm sorry, I'm forgetting the other E.
Eating, exercise.
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 Moderate.
And
Yeah,
D
any
for the,
likewise.
yes.
It is
And
not
D for
gymming.
the,
I'm not saying this stress, so you go to gym. Any moderate exercise, yoga, whatever you can do at home. 40 to 45, small brisk walk, small jog. Again, it all will detox you.
I think,
And
I
as
think so that's how.
correctly, the sleep pattern is the most important thing. Our body, जो प्रभु ने बनाई है हमारी शरीर, वो biological cycle day cycle के साथ associated है. N number of hormones imbalance, everything goes for if your sleep cycle deteriorate. Our brain detoxified when we sleep. So adequate 6 to 7 hours sleep at night is required to detox your brain and give a better life. And it is not only migraine, every aspect, your hypertension, diabetes, any stressful condition will precipitate. So sleep is very important part of the life.
So another important part associated to sleep, please correct me if I'm wrong here, that whenever nowadays we go to sleep, we scroll our mobile and reels for 15 to 30 minutes. And I think that is a very big hurdle when it comes to sleeping properly on time, or which is a very crucial part of sleep hygiene, because our eyes are constantly on the straining for the blue lights. And I think that is a big disruptor towards our sleep
You
as
are
well.
very correct. You are very correct. It is not only blue light, it's the flashes of light. Whenever we are on any screen, mobile screen, and as the screen is smaller, we concentrate more on the screen. So flashes of light, more flashes of light, more concentrating and distracting medias. आजकल everybody is for रील देखते हैं, पूरी मूवी भी नहीं देखेंगे, रील 5 मिनट 10 मिनट की. तो every 5 minutes your topics are changing. The
So,
scrolling is like that, and with that you keep the mobile aside, and those activity will continue your brain. And a whole night those things in subconscious mind it runs. There were a lot of things has been done in subconscious and conscious mind study, and it is found that whenever you go for sleep, before at least 24 15 20 minutes you should away from all these things. Any book which is making you excitement, any media, any movies, you should not take it. In spite of that, I prefer you sit down before sleep, you sit down on bed and concentrate, but just relax होके बैठ जाओ. अपने जो भी ध्यान आ रहे हैं आराम से सुनो 10-15 मिनट, अपने आप you will feel sleep, and the sleep before 5 to 10 minutes आपने एक बार ध्यान मुद्रा में बैठे, you will have a best quality of sleep. I can challenge anyone.
I think that these things are very doable for our patients, for the
Yeah.
people who are experiencing migraine. I think if they take care of this, they can manage half of the symptoms by themselves without even having a medication.
Yeah.
As we're talking about lifestyle and things, what can be done and prevented, I have another question from our audience. I would just like to present this. So this is that my sister is pregnant and has started experiencing frequent migraine attacks again. She's afraid to take any medication. What treatment options are considered safe during pregnancy? Dr. Smith, if you could explain us this and guide our audience on this question, please.
Well, actually, there is hardly anything which is safe in pregnancy in terms of treatment. The only thing which is allowed in pregnancy is a plain paracetamol tablet for aborting an attack of migraine. Apart from that, I think I should not be giving it on a general platform as to what medicine is to be required. Most migraines, up to 70% of them, are either gone or significantly reduced during pregnancy. So if a lady is experiencing increased frequency of migraine, then she should contact a neurologist to see if it is actually migraine or something else, because there are a lot of hormonal changes which happen during pregnancy. Maybe it is something else cooking up and we might be keeping it as migraine. For aborting an attack, paracetamol is safe, and there is no other problem. There are certain wearable devices which are remote electrical neuromodulation devices, which are put in the arm, and you stimulate it, and it actually sort of trains your brain to control your pain. So that is something which you can give in pregnancy and is okay, but nothing without consultation from a local neurologist.
Thank you, sir. Thank you so much for explaining us the safe practice during the pregnancy if a woman experiences migraine episodes. As we are moving ahead and keeping the time we have and with everyone's interest, I would like to take last few questions to all my speakers, and I request a brief explanation on this. And if required, you guys can explain this and a public message for the regional audience our speakers have. I would like to ask my question to Dr. Manmohan. So, by looking at the bigger picture, there are meaningful regional variations in migraine prevalence, triggers, and access to treatment across different parts of India when we talk about the diversity of our country.
Actually, there may not be many differences, ethnic differences or those, except the eating habits sometimes. There are some substances which have not been mentioned so far used in the restaurants, which are like monosodium glutamate. That is well known to precipitate headache, a particular type of called restaurant syndrome. I will not name the prefix because it may create unnecessarily debate. And second is, we have also discussed about alcoholic drinks, especially wine. Red wine, and that has certain substances called tannins, and that can precipitate headache. So those plus the shift duties, poor hygiene, sleep hygiene, stresses, pollution. Now, in certain part of the country, pollution, we have brought out a special issue of neurology of air pollution, in which there were 2 articles on headache alone. So pollution that time definitely precipitates not only the migraine, but also the muscular headache, which can further aggravate the severity of migraine. So whenever the globally, anyway, Sir William Osler said, about headache or any other disease, listen to the patient and try to commute it out. But sometimes that cannot be so easy about headache. So patients should be asked about various duration, severity, frequency, during periods or during menstrual cycle or not, and how does it disturb daily life? What are the precipitating factors or stresses? All those, if we take into account, patient if writes, I give them a performance, note down what all this, since how long, what type of headache, what happens, what do you do, how do you get rid of it, what are the stresses? It's very helpful. Now most of the patients world over come with AI generated. I have Chat GPT, I have headache, please tell me what should I do. Chat GPT will give all types of headache. They send us to us a video consult. Very difficult. Face to face, listen to the patient and detail, and we must give time. Neurologists, we should give time to and no, not a single bag full of black films, 2 bags black films can solve the issue. So it's more of a clinical diagnosis, and the very good treatment is available. Termination of headaches as well as prevention of headaches. Thank you.
Thank you, sir. Thank you so much for clearing us the factors which can be associated with this. As we move ahead, my next question is Dr. Sumit. Sir, modern lifestyle continues to evolve rapidly. So, how do factors such as urbanization, environmental exposures, changing lifestyle, and workplace stress influence migraine burden across region, specifically when we see in the tier one areas?
So I think the 5 commonest causes of migraine today is YouTube, WhatsApp, Facebook, Swiggy, and Zomato. So all these things keep you awake till the very early mornings. You keep on watching reels, you keep on ordering food, which is total nonsensical from ordering food apps. You don't sleep in time. Now, the simplest 3 commonest triggers for migraine, as Joy rightfully said, eating in time does not cost anything. Sleeping in time does not cost anything. Healthy eating does not cost anything. In fact, you save money. बट
Yes.
ये 3 चीजें नहीं करनी, दुनिया में सारी चीजें कर लेंगे. अपने लाइफस्टाइल को नहीं चेंज करना, 70,000 रुपए की दवाई ले लेंगे महीने भर में, वो चलेगा. 50,000 रुपए का स्विगी से खाना ऑर्डर कर लेंगे या जोमेटो से खाना या किसी भी फूड ऐप से खाना ऑर्डर कर लेंगे, वो चलेगा. रात में 3 बजे सोएंगे, सुबह 7 बजे उठ के जाएंगे ऑफिस में, बॉस की डांट खाएंगे, उसकी वजह से टेंशन बढ़ेगी, उसके बाद माइग्रेन बढ़ेगा, फिर डॉक्टर के पास जाएंगे और उससे कहेंगे मेरा ठीक कर दो सर दर्द. आप हमारे को ये बता रहे हो कि मैं हाथ पे चाकू मारूंगा लेकिन खून नहीं निकलना चाहिए, ऐसा कुछ कर दो डॉक्टर. सो यू नो what are your commonest triggers. You know, just by changing simple things which Dr. Joy and everybody else in the panel rightfully highlighted. And very, very importantly, we are talking of what? Biomarkers. We're talking of high level of MRIs. अरे भाई सिंपल मरीज से 5 मिनट बात करके डायग्नोसिस बन जाती है, 5 मिनट उसे समझाने से उसका ट्रीटमेंट हो जाता है, लेकिन फॉलो तो मरीज को करना है ना. If the patient is not following what you are saying, how on earth can he improve? उसे मालूम है छोला भटूरा खा के मेरे को हेडेक होता है, लेकिन मैं छोला भटूरा तो जरूर खाएगा. I will order it, which has been cooked, I think 3 days ago. The cholas are coming 3 days ago. The bhaturas are made in the morning. They are warmed up and sent on Swiggy or whatever. I'm not naming any food apps. So I think these three things are the curse of urbanization. We all know it, but none of us wants to follow it. That's why the migraine incidence is increasing. And like other disorders, migraine capital of India is India. The migraine capital of the world is actually India.
So very rightly pointed out, and very straightforwardly mentioned that what things are there, what we are doing, and if we ignore them, that's definitely can help us. But then also keeping in mind that this should not be done, we do this. So I think that is the biggest learning from today's session, that if we know what is right for us, we are not doing just by simply ignoring the things. And when it comes to the episode of migraine, we just complain and try to ignore the medicines as well. So thank you so much, sir, for highlighting on that. My next question is Dr. Dipendra. So, given this widespread burden, should migraine receive greater attention within India's public health priorities and non-communicable disease strategies? As when we see, strategies or draft is made on diabetes, cardiac arrest, and other disease like this, and why should it be done? So,
Attention within.
sir, you're on mute. So,
Yeah.
yes, now we can hear you.
Yeah, migraine deserves greater significance, greater attention within India's public healthcare priorities and in relation to non-communicable disease strategies. Despite its high prevalence, substantial disability burden, economic impact, it remains very unrecognized, underdiagnosed, and poorly integrated into the national health programs. If we see the scale of burden in India, like we have already discussed till now, approximately two, like sir has already said, Sumit sir has already said, the headache or this migraine has become the number one disease of the India. Around 213 million people are affecting and living with the migraine. Population-based study has shown that 1 year prevalence around 25 to 26% region like in Delhi, NCR, and Karnataka, far exceeding global averages. Disability and productivity loss. Migraine is the second leading cause of disability globally and major contributor to neurological disorders, decreasing the daily activity, daily assessment of living in India. And if we see, it produces a broader impact, like it affects education, missed classes among students, workforce productivity, quality of life, with the comorbidities like anxiety, depression, amplifying the burden of the disease. So, why greater priority is needed in this particular age, in this particular era? Because it is under recognition is policy. India's current non-communicable disease strategy depends upon heavily on the cardiovascular disease like diabetes, cancer, stroke. But disorders like migraine receive limited dedication attention despite their rising contribution to overall disease burden. Like Soni sir has said, if he is having migraine, 4 to 12, 4 to 48 hours have gone. And now, if we see the global burden data, that non-communicable neurological disorders here actively causing the disability in among the young middle-aged population who are going to the office. Health system gaps are there, low awareness among the public, providers to misdiagnose. Often, like sir has already said, you don't have headache, you are not having migraine. Migraine is an taboo. So often they use, sir, मुझे headache होता है, sinus headache है, delayed care, overuse of analgesics, counter use of analgesics, access to specialists. All these things lead to increase disability among the young individual, and people are not aware. And if we see equity consideration, that higher burden in women, young people, and certain regions demands targeted action to address gender and socio-economic disparities. So what we should do, the recommendation we should integrate include migraine in NCD screening and management protocols at primary care levels. We should do the public awareness campaign. We should provide training and integrate the health diaries, health digital tools. Like I have already told, many apps are there, and the research and surveillance to generate India specific data. We should do more studies so that we can definitely define what are the things which are triggering. Like sir has already said, people are coming to the OPD, they are using phones, they are using. मेरी ओपीडी में कितने लोग आते हैं, सिंपल क्वेश्चन उनसे पूछो आप, एक सिंपल क्वेश्चन, मैडम या आप कितने बजे तक मोबाइल यूज करते हैं? सर हम तो 12 बजे तक मोबाइल यूज करते हैं, उसके बाद हम सो जाते हैं. फिर again he will use mobile till 3 o'clock, and then subsequently they will have headache. So if we educate them, if we tell them, then only we are able to correctly manage the migraine, and we can definitely we should include into the this greater attention within the Indian population healthcare side. We should educate, we should treat, and we should more people should be more aware of the disease. We should do the social gatherings. We can do daily, not daily. We can do migraine awareness campaign. All these things are necessary to educate the people. So, in conclusion, if I say migraine is not just a headache, it is a major under-addressed public health challenge costing India dearly in human and economic terms. So, if we elevate our NCD strategies in a pragmatic, high-impact manner, a step towards which will reduce the disability, which will support youth, which will support women, and advance universal healthcare coverage. So definitely we should include and given more importance in according to other non-communicable diseases.
Thank you, sir. Thank you so much for explaining us this. I'll quickly move to my next question to Dr. Joy. So, equitable access remains an important healthcare priority. So, what key healthcare system challenges must be addressed to ensure equitable migraine care in Tier 2 and Tier 3, and specifically the rural communities as well?
Yeah, I mean, most of it has already been discussed, but the priority is that we need to recognize that sleep is your biggest biological restorer and medication. And four tenets need to be met for the restorative powers of sleep to be available to someone. 7 to 8 hours at the right time. Right time is 4 hours from sunset and about waking up with the sunrise without any sleep disorder, and consistency. Consistency is the key. You can have occasional cheat days for a social occasion, but consistency is the key, and there's so much data to show that. The other, I think, big priority is managing stress. So that is also a very big driver. If you'll see most of my colleagues trying to navigate migraine with medications that help with headaches, and they also manage the anxiety depression spectrum, things like amitriptyline, for example. So in today's world, navigating stress is a very big issue. So somewhere that should be our priority in urbanized living. I think these are two big things. A lot of all the other triggers have already been said. But if you can get these two right, I do certainly think that we will probably need to lean less on medications and injectables and other things.
Very rightly mentioned, sir. Sleep and
Sir,
stress
with your
management
permission,
is
sir, I want to just add one thing, sir. With your permission, sir, I actually, whenever patients are like stress, you have said, sir, it's very important to deal stress in the migraine, sir. One thing I always do in my OPD, sir, I always tell the patient to do the mind relaxation technique. It's a different terms. So what I tell them, you just lie down in the room, close the lights, switch on the phone, just think how your little finger of the legs looks like, and don't imagine anything else, and just tell them you lie down, this is your 10 minutes in the morning, 10 minutes in the evening, and ये आपकी अपनी जिंदगी के 10 मिनट हैं. इस 10 मिनट में पहाड़ आ जाए, तूफान गिर जाए, आंधी आ जाए, कोई पानी मांग ले, बच्चों को बोलो शांत रहो, अपना काम करो, हस्बैंड को बोलो कि अपना वो करे, या हस्बैंड बोलेगा वाइफ को कि आप शांत रहो. तो these 10 minutes are आपकी जिंदगी के 10 मिनट हैं, आपको कब निकालना है, whenever you want to do, whether you want to do in the morning, whether you want to do afternoon, whether you want to do the evening, whenever you want to do, these 10 minutes are your 10 minutes, and over a period of time, around 10 to 15 minutes, patient will have definitely improvement in the decreasing the frequency of the headache, sir. Thank you, sir.
माय डियर, वाइफ को ये बोलना कि शांत रहो,
Sir.
आपकी सेहत के लिए अच्छा नहीं रहेगा.
बिल्कुल सर, I agree, sir.
Thank you, sir. Thank you so much for this practical advice. I would like to take my last question, Dr. Rahul. So, if there was one change you could advocate for, if you had the opportunity to advocate one policy intervention strengthening migraine awareness, diagnosis, and access to care, what would it be?
Actually, if you say one thing actually, I will recommend. Well, I will say from my side, like government of India has given a lot of programs. Like there's Ayushman Arogya Mandir are there. So I will. There's some program like where national migraine and headache upskilling program should be there, so that they educate the lower level of people. Lower level means the paramedical staff should also be educated. Headache is not is only just like a headache. It can impair your quality of life also, or if you whether proper treatment and changing of lifestyle will improve your work efficiency, work performance, and make you comfortable. As Dipinder and Sarah has told you, there's a India is now a headache capital of world. So in this era where everybody is so stressful, day night shift, people are doing work in day night shift, there should be some national program also, so that there are n number of programs for different diseases. So migraine, for the migraine also, government should take up some programs, so where the primary healthcare supporters and healthcare workers are taught to take care of the headaches and stress related issues, and how to keep, and basically they should be more involved in the lifestyle modification that has included sleep cycle kaise rakhna hai, khana pina kaise karna hai. So these are these are positive enhancement. No? When behavior therapy is there, we have to put positive enhancement, positive reinforcement, which can improve this. बाकी मेडिसिन तो है ही, मेडिसिन तो मिल जाएगी, ओवर द काउंटर मेडिसिन भी चल रही है, उसके लिए भी गवर्नमेंट को दे शुड सम पॉलिसी दैट दे शुड रिस्ट्रिक्ट समथिंग like any type of medicine they are prescribing. Even triptans are over the counter nowadays, so people are taking. I have a lady who she used to take daily one triptan. This is the extreme of over the counter medicine, so this should be stopped.
So you rightly mentioned regarding the program, regarding the control of over-the-counter medicines which are available nowadays, and I think that's how things get worse and out of the hand of clinicians as well. With this, I would like to thank all my distinguished panelists for sharing your valuable insights and your perspective on how we can navigate migraine. And the expertise shared is quite valuable. And this discussion has reminded us that migraine is far more than a headache. It is a complex neurological disorder that we discussed earlier. So, by encouraging early diagnosis, embracing scientific advancements, and empowering patients through right education, that's how we can move closer to ensuring better outcomes and improved quality of life for millions living with migraine. On behalf of Voice of Healthcare, I extend my heartfelt gratitude to all esteemed speakers for taking out time out of your busy schedule and sharing your expertise and experiences with us and for the patients. This has been Navigating Migraine with Experts, Not Assumptions, United for Better Care, Migraine Care, an awareness initiative by Voice of Healthcare and supported by Amneal Healthcare. Thank you so much to all, and we look forward to welcoming you again to another meaningful conversation. Thank you, everyone. Thank you so much.
Thank you.
Thank you very much.
Thank you.
Thank you, everyone. Thank you.
Thank you.
Thank you so much.
Wonderful.